You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have a great guest today. Someone who is in healthcare and also in business. Yuriy Kotlyar from the sunny state of California. How are you?
I'm good. How are you?
I'm great. Thanks for coming over.
My pleasure.
What is
Thanks for
American
having me.
Health Connection, Yuriy?
It's a call center, healthcare call center.
Tell us more about it.
So we specialize in central scheduling. So basically, we kind of started this industry. We're the first outsourced central scheduling call center in the country. Basically, when you call the doctor's office, you sit on hold for 45 minutes and then someone answers the call. We try to solve that problem. So we specialize in central scheduling, work with hospitals, clinics, basically the entire spectrum of the healthcare industry.
Interesting. How did you come up with this idea? How did you get involved in this business?
It's kind of a long journey. I was in telecom at the beginning in the mid 90s. So when the VoIP was first discovered, I went to telecom business, had a telephone company that at one point designed ACDs, and then also was a long distance carrier, international long distance carrier for a while.
Mm-hmm.
And then when telecom was about to crash in the late 90s, I switched to healthcare at the medical transcription. I was a partner in the medical transcription company. So that gave me the experience that I need. And then like in the late 2000s, I kind of saw the end of transcription because Epic back then came up with templates. Speech recognition was taking its toll, but not as much as templates. And also at the same time, there was no call centers. So basically nobody had call centers at the time. So that was kind of an idea to combine my telecom knowledge and healthcare knowledge. And we created this company to solve that issue of patients trying to get in and call in doctor's office. And so we created that. We created the company, created a call center that could solve that issue of patient access, basically.
Interesting. So tell us a little bit more about what is the business, how is the business functioning, and how do you serve the healthcare community by doing that?
So all of our agents are remote all across
Mm-hmm.
the country. I think we're like in 39 states or so right now. We basically assume the functionality of a call center.
Mm-hmm.
A large portion of healthcare facilities now have call centers, but maybe another 30-40% don't. They still decentralize, so you call the doctor's office and you get transferred and this sort of thing. So we basically outsource that. We take that responsibility. So when you call a clinic, we answer that call. We and our representatives, our agents, schedule those appointments. So it's a very well managed process, very well controlled. We have excellent quality. It's not like you get on those answering service or you're offshore it. We're 100% USA based, so it's a very as high as quality as you can get. So
I see.
Very high quality individuals, very well trained individuals, and also our management and QA process also allows us to have this very tight control of the entire production.
Mm-hmm. Interesting. So you have to be partners with clinics, with doctors' offices, and you also have to have a customer service for the patients, really, really good. Correct?
Right. Absolutely. Yep.
Yeah.
Yep.
So you're in a very niche kind of business in healthcare, so to speak, because you have to be nice to the patients, you have to be nice to the doctors, and get their business. So how do you make money?
Well, we partner with the clinics, so they're the ones. We basically assume their call center responsibilities or front desk responsibilities. So they're our customers. So the clinic or hospital is our customer, not the patient.
I see. Do you think this industry is going to evolve in the next few years where even the remote agents are going to be obsolete, and AI is going to probably take over the whole speech and scheduling. And how do you see this evolving?
Well, we have as much, we develop all of our own technology. And we have a lot of AI development as well. So we're at the forefront of everything that pretty much anybody else has in that realm. Um, it's a lot more than just technology. Healthcare is a lot different than talking to a bank. First of all, the variety of functions is so large, variety of accents. Besides all of that, people are very hesitant talking to a machine.
Mm-hmm.
So we use a lot of AI on the back end, for quality control and for things like that, for workforce management. But the front end, I don't think it's going to be in any, at least for the next decade.
Mm-hmm.
And if it is, then we'll have it probably before anybody else does.
I see.
Um, it's just like even adoption of a web chat or apps or anything else like that is extremely low. People just don't want to do that. They want to talk to a human when they schedule something that
Yes.
relates to their, life.
Yeah, I agree. I agree.
Yeah.
Every time I call, a company like this, and I get a virtual, you know, person there, and I'm trying to get rid of it and get to the real human to ask my questions. But this is
Right,
probably a
right.
challenge for you, being able to supply those people on the front end for the discussions with the patients and doctors in the same time.
Yeah, I mean, it's obviously, staffing has been a challenge for everybody, but we've been doing it for almost 3 decades now. Three
Mhm.
decades now. So we know how to find qualified individuals. We know how to train, and we know how to handle this whole thing.
Yeah.
So it's
How big is your company right now?
we have about 2,000 employees. Yeah,
I
so
see.
we're
So
actually
Yuri,
the first and the largest call center in the country. I mean, healthcare call center in the country.
yeah, that's great. So do you consider yourself successful right now at this point, and what does it mean to you?
Well, I mean, everything is relative, you know. Where's the top, right?
Yeah,
So, I mean, you look at people who are a lot more successful than me and have done a lot more than me. So there's always something to strive for. If I say that I'm done and successful, it's probably going to be the end of me, right? So
you
I
have
don't
to
know.
keep going.
Right, right, right.
Interesting. Um, well, this is something that not a lot of people would take on, this kind of challenge. Do you think they have any kind of skills or habits that are different than other people?
You mean like call center agents,
Yeah,
or
for someone to be a
for
CEO of
myself?
such a
Oh, for
company,
myself.
for yourself, yes.
Um, yeah, well, I enjoy it. I like it. I've pretty much done it like most of my life, I guess. I've been in business and created a lot of new things and I always try to find new things to do. It's just something I enjoy. Some people like to work and do the same thing every day. Some people like to
Yeah.
jump from one job to another. I like to, make improvements. I like to create things that, um, you know, not only, I mean, financial aspect of it is comes along, but my main interest is in creating something new that is, exciting for me. Maybe
Hmm.
for other people, helps other people. So that's kind of what I like to do.
Yeah, absolutely. That's important. Do you think there is anything in your career so far that kind of didn't necessarily work out and kind of set you back and motivate you more to go forward? Do you have an example of anything like this?
Yeah, I mean, obviously over the years, I made a number of mistakes. I don't know if I want to bring up examples,
I would like to, so we
but
can all learn from it.
yeah, but you know, there's someone said like if what makes you better, it's number of errors you make, right?
Yeah.
Hopefully, I learn my own on other people's errors than on myself, And yeah, I mean, I took wrong tracks before, even when I had telephone company. there were a number of things that we did that didn't pan out. The same thing in transcription, the same thing in this company. Like when we started the company, we were kind of naive, thinking that we could do this, off the get-go. I mean, we had knowledge and technology, but so, like, let me step back a little, just to give you a little background. For example, if you look at healthcare, right, the way it operates, the way healthcare institutions operate is first, if you look at, for example, healthcare IT department, right?
Mm-hmm.
They used to have a giant IT department. They had a data center. They well staffed internally, right? As time went along, the Dell came around, and they started outsourcing IT. They started outsourcing data center, right? So now, basically, if you look at healthcare organization, they have a skeleton IT department, and most of it is outsourced, right? You look at transcription, for example. In transcription, it used to be a transcription department that a bunch of people sitting there typing dictations, and then it got outsourced, right?
Mm-hmm.
For better quality, for faster turnaround time. You look at coding, you look at billing, any number of services that hospitals, clinics had in-house eventually got outsourced, except the actual medical care, which the way it should be, because all these services are businesses on their own. And if you
Right.
try to run businesses within your own business, you can never be good at it, right? So the same idea with call center. Call center is a very tough business. It's very detailed oriented. And if you try to run it within your own business, when your primary business is to take care of the patients, right? Not to run a call center, not to do billing, not to run IT, or
Right.
develop technology, or any of those things, right? So we were naive back in the day. We thought we can circumvent this process. And in some cases we could go in and we could outsource the entire department and handle the call center. But in reality, it didn't happen. They still go, like, if you look around, all the hospitals, majority of them at least, they go through the cycle. They build call center. It's giant, super super expensive. They can't get performance out of it. They don't get good speed of answer, good KPIs and stuff. And then eventually they have to outsource.
Mm-hmm.
So, that's one of the kind of, I don't know if it was a mistake or not, but it was definitely naive on our part. Then we thought we could just circumvent this process and just go straight to outsourcing.
Interesting. Yeah, that's very true. I think all those ancillary businesses that are around the healthcare, and they don't necessarily have anything to do with the patient care. And they help the doctors, they help the medical staff, but they have to be run independently, like you said. What do you think is the most challenge aspect of your business?
So in the old days, like when we first started, because we were the first to do this, so we had to sell the idea, and then we had to sell the product. These days it's a lot easier because it became a known line of service.
Mm-hmm.
So it's a lot easier to sell. People already know that they can outsource a call center. But still, you have to overcome this. I don't know how to explain it. Basically, a lot of these organizations, they still try to keep it in-house. They think that because they can walk over to the call center and see that someone is there, somehow it makes it better for them, which is
Yeah.
not the case. Those people, they still, may work, may not work, you don't really know. But just because they're there doesn't mean it's more personable.
Right.
They still have this kind of possessive, I don't know if it's what's the right word to use. They like to possess that. They want to keep it.
Yeah.
They want to have their fingers on it rather than send it out, which doesn't make a difference. It works better outside. But that's one of the biggest challenges.
Mm-hmm.
Is just
Interesting.
for them to being able to let it go.
Yeah. Now, if you would think of yourself as a successful businessman, and you started this enterprise many years ago, and you're doing really well with this, what do you think some skills or habits that you personally have contributed the most to your success?
Never give up, never surrender. Is that from Star Trek or?
Yeah,
That's
that's very
basic,
important.
right? I mean, if you hit a wall, you just go around the wall. If you hit some, that's kind of what you have to do. If it doesn't work, you try another way. You know, come back to it. Go back to sleep and then come back in a couple of days to see if it works again. Or if you miss something, you have to fix it.
I see. So it's a little bit more to be a little bit more persistent than anyone else.
It's not just being persistent because you can keep hitting yourself against that wall and nothing's going to happen. You got to find a different way to do the same thing.
Yeah, a little bit outside of the box
Right. You need to
thinking.
find the way around whatever obstacle you have. And
Yeah.
there are thousands of these obstacles, happen in the life of business. Because all those odds they lined up against you, uh, a lot more than for you. Like I think 95, 98% of startups fail. That tells you something.
Yeah, it's very interesting how these things go, and how do you see this evolving in the next few years? Um, do you see any big change in the way you're gonna do business?
Um, Not necessarily. I mean, sooner or later, technology will evolve.
Hmm.
That will probably decrease the number of calls, but I don't think it's coming in any near future. It just, you know, but we definitely develop we have technology that is at the forefront of everybody else. So we have the same things or better.
Yeah. Do you think what is the proportion, for example, in healthcare, especially where people prefer doing it online rather than talk to a human or call someone?
Well, have you ever tried to schedule an appointment online with Epic? It's a serious question.
I
Have you?
didn't, but I heard some interesting stories.
Well, I mean, you can probably schedule with your primary care for annual wellness visit.
Yeah.
You can probably schedule a follow-up appointment with someone, but that's it. If you log in into your any of those EMRs, you can't really schedule much. So
Yeah, so this is my question here. You talked about technologically advanced business in the next few years, but if those platforms continue to develop, the electronic medical record platforms, and they get over the whole market, how do you counteract that?
well, why haven't they so far? Why haven't they done that?
I don't know. I think my answer would be that, human always gonna be human. They want to talk to a person, um,
I would
especially
schedule
in healthcare.
I would schedule appointment online if they let me, but they don't. None of
Well,
them have.
that's my question. I mean, it's much
Why
easier
is
to
that?
go on your phone and schedule an appointment with your doctor whenever it's available, rather than wait on the line, call someone, wait for that person to do your appointment. Isn't this something that you personally can solve in a way or another and get around this like issue?
No, I can't. It's up to the epics of the world to do that.
Yeah,
We can't do it. There's no interface. Like there are companies they say, okay, we're gonna schedule to have online scheduling and this and that. You can't do that. The interfaces don't work. So they
I see.
like EMRs, all the large EMRs, they don't let you do that. You can't schedule inside of them, or you can't interface. So, some of them, like there used to be a company called ZocDoc a
Yeah.
while ago. I don't know if they're still around or not. So what they used to do, they would just stick appointment on the schedule without verifying insurance, without doing any pre-reg or anything else like that. So they had the huge problem was there was a huge rate of no-shows, and also those insurances may not have been accepted at the facility. So sooner or later, they just got rid of them because it was a lot more work to use those companies than doing it manually. And also, they would book up time slots without actually knowing that that patient would show up, or even it's the right patient, or even it's the right doctor, or insurance
Hmm.
is accepted over there. So
I see.
there's a lot of work that needs to be done in order to schedule an appointment. It's not that simple. So maybe that's the reason that the MR companies don't have it. But it's just, if
I
you
see.
if you try to schedule a appointment, log in to your provider, see if you can do it.
Yeah, it's always a challenge. I know that, and most of those platforms are that's their main issue with being so patient. I would say patient friendly. Um, but always talking to a human is going to be the best choice, no matter how you take a look at it. I mean, there are people out there who are not proficient with internet, who are going online or scheduling, even if they want to. They want to talk to someone at the office or at the call center or whatever to help them out. And I think that's the human aspect that cannot be taken away. Um,
Absolutely. But the besides that, I mean, I'm as proficient with the internet as anybody else, and I can't schedule an appointment online. It's just that because there's no, it's not there. The capabilities are not there.
yeah.
So,
So after all these years of running this business and being, very successful in it, with your experience, looking back at yourself when you were younger, what kind of advice would you give yourself?
um, learn more on other people's mistakes.
Yeah,
Yeah, you know.
that's a good advice. That is a good advice. Um, Yuri, what projects do you have going on? What's exciting for you right now? What do you look in the future for?
Well, we, from technology standpoint, we're actually developing some very interesting things. We have quite a few scientists, AI scientists that we
Hmm.
employ. We have a large development team that we make all of our platforms. We have our own ACD platform. It runs a call center. We have, all sorts of like portals and interfaces and document management solutions and stuff like that. And we develop quite a bit of AI in the back end to run these things like workforce management, staffing,
Hmm.
quality control. It helps a lot. So that's been one of the exciting things. Um, and um, with everything that's going on in the industry, with staffing shortages that most facilities um, have, and some even outsource like overseas. Uh, there are a lot of these call centers popped up, like in Philippines and I don't know in India and so forth. And we're picking up a lot of those clients now because even though they think it's cheaper, in reality it's not. It's just they put a lot of people on it. They charge a lot of money, but the quality is not there. They can't duplicate what we have in the United States. We can't do. They can't duplicate the quality.
Yeah,
and then patients suffer. Patients suffer, and the businesses themselves, the clinics suffer because if patients can't get in, they go somewhere else. You call someone, schedules you to an appointment, and the whole thing is wrong. And you
yeah,
show up, and appointment is not there. They schedule two appointments for you, and there are a lot of things that can go wrong with this process. And these patients, they just go somewhere else. Or if they don't answer calls, for example, they also go somewhere else. The physicians are underutilized.
hmm hmm
So it creates that bottleneck, and we've been recently within the last year or so, we've been picking up a lot of previously outsourced to clinics to overseas. So they coming back and they realize the need of having very high quality type of work.
yeah,
We're not by any means the most expensive company. We're kind of like a Cadillac at a Chevy price, basically. So but we are definitely a Cadillac service. It's the highest quality you can find. So that's we're still developing that. We improving a lot of processes. We have a new training um, system that we've developed that even brings our agents even to a highest level as far as being able to communicate, as far as being able to explain explain the services that clinic provides, and being able to even improve like things like conversion rate.
Mhm.
When new patients call, it's actually an important factor.
Absolutely.
Most clinics don't think about it. They think,
Yeah.
a call center is an expense. It's the front, it's your face, it's the face of your business. So if we can improve the conversion rate, being able to communicate with the patient properly, being able to explain your services, being able to schedule to the right doctor, for the right appointment, and all those little things that make already unhappy person a little happier. Because the truth is, a patient is already unhappy.
Yeah.
They're in pain, they're unhealthy, whatever the situation is. It's already, you're not like you can't have I don't know if it's an appropriate thing to say, like like you're not looking forward to your next colonoscopy, right?
Exactly.
Right. So that's part of the things that we try to resolve and make those patients even a little happier, being able to bring them in and give our clients that a little better conversion rate.
Yeah, I think that's a great point you made. The fact that the call center is probably the face of the clinic and the first contact with the patient when they call, because they're not going to talk to the doctor.
Right.
They're not going to talk to the nurse. They're going to talk to your people that are, they need to be trained to be pleasant and have a good customer skills and make them comfortable and like you said, retain the client.
Right.
Which is a great quality, and I think the training needs to be top notch on this, because the alternative is very sad. Like if you have
Yeah.
someone who doesn't know how to talk to a patient, who doesn't know what to do, obviously they're gonna hang up and go to the next clinic.
Exactly. There's a lot of competition out there.
Yeah, and how do you manage this? Do you have healthcare workers and providers that are training those people?
Yeah. We have management staff, we have trainers, we have auditors, we have supervisors, key managers. There's a lot of besides actual agents who answer on the front line, answer the calls. There's a lot of support staff that maintain this workforce and look after all the systems and all the processes that happen behind the scenes that are not directly visible to the client, but necessary to maintain the operations and the quality.
Yeah, it's very important, and I think the point for this specific podcast is that our audience, the healthcare industry in general, the medical professionals, are probably not even aware of the amount of work you guys do, and you have to be trained well for them to be successful. Because like you said, there's so many outsourced services in the healthcare industry that it doesn't really matter how good a doctor is if you can't get to him.
Right. Yeah. Actually, if you look at like Google reviews for a lot of clinics, they say excellent doctor, but it took me 4 times to call to get through.
Yeah.
So
Exactly.
it's you see that like most of the negative reviews are not for the doctors. The most negative reviews are for for the patients to be able to get in. Yeah, right.
Yeah, for the
right.
clinic.
For the clinic. Yeah. Yep.
Right. And most of them are private. And
Exactly. Right.
and then you get at the end of the month, you get a business review with the doctor, and he's like, "What happened? Why don't I have patients?" But they don't necessarily think that the call center is the most important thing to attract them.
Exactly.
By the
right.
customer service. And
Yeah.
that's a great point for them to be aware of. Like any other outsourced service, like billing services is the same thing. When patient call with a billing issue, and many other services like this.
Exactly.
Yuri, it's been a pleasure talking to you. I think medical professional in general should pay more attention to your kind of business and appreciate it the way they should. How they can reach out to you if they need your help?
AmericanHealthConnection.com. As simple as it sounds.
Excellent. Thanks for joining us today, and good luck with
Thank you.
everything.
Thank you very much. I appreciate it. Thanks for having me.
Sure.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.